I've been looking for ages, hasn't I? At loads of places, and it was all a bit expensive, so I'd kind of put it on the back burner. And you got a flyer through the door, didn't you, Mum?
I did, yes, yeah. So I rang her up. She was in France at the time, and I rang her up and I said, this looks really good. So you had a look on the internet.
Yeah, and I decided to go online, had a look. Next time I was in England, you arranged for an appointment for me, didn't you?
I did. Well, I wanted to find out a little bit more because I was just conscious that I wanted you to have the right treatment. So I rang up and I asked lots and lots of questions, like you would if it was your daughter having a treatment. And they gave me lots and lots of information. And I even rang back and got even more information, things that I thought of, before I felt happy enough for Charlotte to go and have the treatment.
Yeah.
So.
Yeah, and so I went back at Christmas and she's got all this stuff for me, went for the consultation and things, and was really happy, obviously. And we rang up to see when I could get an appointment for when I was back, and the only one was on Friday the 13th in February. So I was saying to her, oh God, I don't know whether I can do it. She's like, are you honestly going to let that stop you? I was like, oh right, okay then. So I ended up getting it done on Friday the 13th.
You did? Yeah.
And then, so that was me.
I was completely different because I think partly because of my age and different prescription. I had a very high prescription, so I was -9 in one of my eyes. So I had to have a different treatment, and I didn't want to know. I knew afterwards how she was, but other than that, I didn't want to know. Yeah. So I just went in with my eyes closed, really.
Yeah. Yeah, because I'm totally different. I researched it online, having a look at all the different charts and graphs and how it's going to be done and things. And Mum was just like, I don't want to know, I don't want to know, I don't want to know what they're going to do, because that's just how she deals with it. But I knew exactly, and then as soon as I'd start saying, well, what they're going to do is they're going to cut out, I don't stop. But but you were all right, because she knew that I was okay. Yeah. So even though we did have slightly different treatments, they were quite similar, really.
Yeah, they were. Yeah.
So we recovered together. Got everyone else to do the housework.
Yeah, we did. Yeah. Got a couple of days off.
Yeah. Made out it was worse than it was, so that we could get a couple of days of the housework.
I've got 2 other daughters, but they're not old enough yet. Yeah. I think definitely the youngest one. She's 15, and she can't wait to get hers done.
Yeah, she's already counting the days, because I think the age is 18.
Yeah. So.
But I'd just turned 21 when I got it done. So I think she'll be running in as soon as she hits 18 to check whether she's all right. Yeah. We can share the same sunglasses. Oh yeah, no, we could. I was just saying that downstairs. It's quite sad, really, but one of the good things about it is I can go into Primark and just get a really cheap pair of big, nice sunglasses. I could never do that before because the prescription ones are quite small and they're not as good, really. But we can get these cheaper ones.
Or we could go and get some dear designer ones.
Or we could go and get some dear designer ones, the really big ones, Ray-Bans or something. I want some Ray-Bans. But we could never do that before.
No.
And but we come in together for our appointments.
We do.
Everyone's like, hi, how are you?
Yeah.
We're instead nice. We just talk everyone's ears off.
We do. Oh, you do. I don't.
Yeah, she just sits there going, oh my God.